there's been a stabilisation in the hotspot areas. Do you put this down to improved vaccine rates or the restrictions that are in place?
I think I've all along said that there's no silver bullet, although vaccines are very effective. What I'm indicating is that the actions taken are a comprehensive package, and they were a range of restrictions. They were pushing a lot of vaccine into particularly the younger age groups in that population and lifting vaccine coverage. So it's going to be for other commentators to pull out and tease apart, but like most things in public health, you need a combination of strategies, but going forward we're going to need that mix of COVID safe practices, extremely high rates of vaccination. And can I just echo the words of the Premier? I mean, I actually want New South Wales to be the most highly vaccinated. We're pushing towards the Canberra level, so ACT's got the highest level in terms of their second dose. Let's get up there. And some of the age cohorts I really want to push up. We're still seeing elderly people who are not protected. We've still got 70 plus age group, 50 plus age group. We've still got people that really do need to get vaccinated urgently, as well as our younger age groups who have not previously had such free access to vaccines.
Grab that age group, Dr. Chant. Is it worth opening up the vaccines and allowing more choice now to scrap this idea? I know ATAGI again made the decision, but would you recommend that finally we'll let anybody choose what vaccine they need?
Look, I think ATAGI has guided us very well through this, and I really defer to the advice of ATAGI. At the moment, we are doing a mammoth push. Vaccine will become increasingly available, and we'll look to ATAGI's advice around a variety of things that are being speculated about, the need for boosters, the Delta-specific vaccines, vaccinations for children. This will be an evolving information about and guidance around vaccines, and I think we just need to get used to the fact that vaccination and regular vaccination will be part of our future of striking that balance of living as safely as we can, knowing that we have to function as a society and we have to manage health and well-being in keeping COVID.
At 70%, would you still want to see the 5 kilometre restriction, masks and working from home for people who are not vaccinated?
Health has participated in the roadmap, and we've issued the sort of guidance that we suggest. Obviously, in that roadmap, there was also a note that depending on where communities might be, where the community cases might be occurring, there might be some additional public health measures we need to put in place. Now, that public health measure could be targeted vaccination. You know, we know a particular area or a particular vulnerable community is under-vaccinated. We might need to go in there and vaccinate them. It might be a range of other restrictions or other elements to the response. So again, we'll be learning how to get the virus suppressed as low as we can. And the thing the community can do is continue to follow those COVID safe practices and get vaccinated.